Today's VETgirl podcast is brought to you by the American Heartworm Society, whose mission is to lead the veterinary profession and the public in the understanding of heartworm disease. Every 3 years, the AHS hosts their triannual Heartworm Symposium, a scientific meeting that draws leading experts on heartworm disease, industry leaders, and veterinary practitioners who want their protocols to reflect the latest, greatest information about this serious disease. Go to heartwormsociety.org to learn more and to register for the 2025 symposium, which will be held in Fort Worth, Texas, September 4th through 7th.
Hi, VetGirl here. Today we're going to talk about feline heartworm disease with Dr. Chris Adolph, parasitologist and American Heartworm Society board member and a veterinary specialist with Zoetis. He's going to address important questions about when and why veterinarians should be screening cats for heartworms, the importance of prevention, and how we can communicate with cat clients and help them understand the value of heartworm prevention and testing in their pets. Dr. Adolph, would you tell our audience a little bit about yourself, your background, and why you're passionate about this topic?
Certainly. Thanks for having me on today. I graduated Oklahoma State College of Veterinary Medicine, 1996, go Pokes. And I was an associate veterinarian for a year and a half. And then I had the opportunity to go into a partnership and started running my own hospital. And then 4 years after that, I became the full owner. And that's what I did for the next 17 years of my career, was a practice owner. And I saw then, practicing in Tulsa, Oklahoma, the importance of all parasites, heartworms, external parasites, internal parasites, and realized that I didn't pay enough attention to parasitology in vet school. And so I really that was an area of focus for me. I went to parasite specific CE, really educated myself and got to know a lot of the premier parasitologists across the country. And that was my introduction and my foot in the door into the world of being a parasitologist. So while I was in practice, I had the opportunity to go back to graduate school and train with Dr. Susan Little at Oklahoma State. And from 2010 to 2013, I practiced full time while I was in grad school full time. I got a master's degree, and a big chunk of my master's thesis was on feline heartworm disease. While I was in the middle of preparing for the board exam, then I had the opportunity to get a full-time parasitologist role. So I stepped away from practice for a number of years. And so I've been a full-time parasitologist for the last 10 years. But a couple of years ago, I started having an itch. And I had another opportunity present itself where now I work somewhere between 2 to 4 days a month in practice. I'm a general practitioner. I see a lot of urgent care, but I also do a lot of wellness. And so I get to speak to clients. I get to educate them on all of the evils of all parasites, specifically heartworm disease. So going forward, when I say, here's how I talk to clients, it doesn't mean here's how I used to talk to them back when I used to be a real doctor. I still get the opportunity to do this to this day.
Well, thank you, Dr. Adolph, for joining us, and welcome to VetGirl. We will be hinting and jumping in a little bit about your clinical experience here later on in the podcast. But first, what is really amazing to me is some of the statistics around feline heartworm disease. So the first case of heartworms in a cat was reported more than 100 years ago in 1921, which seems like a lifetime ago for many people, right? Like that is a whole lifetime ago. A century later, many veterinary professionals continued to have these questions about everything from heartworm disease incidence in cats to understanding how heartworms affect cats to even knowing how to diagnose and manage feline patients. So recently, the American Heartworm Society made significant revisions to the recommendations in their feline heartworm guidelines, providing clarity on how and when to screen cats for heartworm infection, as well as, the many options for symptomatic management of cats. So perhaps starting with a quick overview of feline heartworm disease itself, as veterinary professionals, and I'm going to pitch this to you as a true-false question, We recognize that cats are susceptible to heartworms, but many of us don't see cats as being as at risk as dogs. Is that a true or false statement?
This is one that I can definitively say false, for sure. There are a few similarities between canine feline heartworm disease. It's the same parasite, Diphtheria immunis. They are transmitted by mosquitoes. They go through a journey from infection to having adult worms in the pulmonary arteries. That's really where the differences end. And how I phrase this to veterinarian is take everything you know about heartworm, and now when you think about cats, forget everything because it's a different disease process. It manifests differently. It's more difficult to detect. And, we can't treat a cat with an adulticide. So we have to know, okay, once I do get a true positive cat, what's next? So there's a few similarities, but many, many more differences. And in my opinion, one of the reasons why this isn't top of mind or it's not a true risk is just the lack of routine testing of cats for heartworm disease like we do dogs.
Yeah, definitely. I'll be honest, I have two cats and I'm like, do I test my cats? I don't know. I don't know if I do. I should revisit that. So I know you primarily work in industry, but you did mention that you do continue to spend some time in clinical practice in Oklahoma. You know, talk to us about the value of having those conversations with pet owners, specifically our feline pet owners, and raising awareness about feline heartworm disease and how you navigate those conversations, getting these cats tested, and then ultimately, addressing prevention.
Certainly. And I definitely want to address the client conversation, but I find the client conversation to be easier than having it with the team because, when I was a practice owner, one of the things I realized early on was unless I've got a team buy in to a concept, be it routine blood work or pain control protocols, but until I've got the whole team on board, my compliance with clients wasn't as high. So my first step when I wanted to do a protocol change was get the team buy-in. Really spend time at team meetings with here's the why behind what we're doing. And for this example, we went in the mid 2000s from not screening cats to screening cats. And when I did that, there was a lot of moaning and groaning with my team, and my team was awesome. They're like, oh my gosh, we're going to have to draw more blood from cats, and we're going to have to tell owners that, this is what we're doing, and it's going to be really hard. But once I was able to get, here's the why behind it, here's the why. And once the team started seeing positive cats, it went from a theoretical exercise to oh my gosh, Dr. Adolf was not completely full of feces about this feline heartworm concept. We have positive cats. And once my team got on board, that client conversation with the client went easier because I was generally about the third person talking to the client about feline heartworm disease. And we know that in any human being to like change behavior or to learn a new concept, they have to hear it multiple times. So by the time I'm telling them about it for the third time, it's really starting to sink in. And I honestly believe the fact that I was testing, that I was finding positive cats in cats that were otherwise physically normal, no clinical signs at all. This allowed us to have more success, not only testing, but getting more cats on preventive.
Yeah, I love that team approach. Thank you for sharing that. Full disclosure, I am a veterinary technician. And so if I'm pulling blood from a cat, it is helpful to know what tests the veterinarian will order so that I can get one stick, right, and get all the blood that's needed. So I love getting the whole team on board. As a profession, veterinarians today have a pretty reliable handle on the incidence of heartworm disease in dogs because of, perhaps personal experience treating and diagnosing that, as well as surveys like those conducted by the American Heartworm Society that track heartworm diagnosis across the US. However, it seems we don't really have anything comparable to that in cats. So, what have been the obstacles to generate better data? And are there studies out there that more veterinarians need to know about?
Absolutely. So when we think about dogs, we now have acceptance almost nationwide that dogs on heartworm prevention, are off heartworm prevention, hit and miss heartworm prevention, we are drawing some blood from those guys at their annual visit, and we are doing some heartworm testing. The tests are relatively accurate, and they have very high positive and negative predictive values. And so that's just understood, right? So that's a thing that happens. And when you look at certain numbers, you see vastly more dogs tested because of this concept. Cats get tested, but in far fewer numbers. And I get to travel the country, I get to talk to veterinarians all over the place. And what I have found is, like, when a cat gets tested, there's generally some clinical suspicion of disease. There could be some clinical signs of coughing or vomiting they can't explain. So they're testing. So when you see, the number of positive dogs that were tested, and then the number of positive cats that were tested, in many areas that I go to, the percentage is really close, but there's far fewer cats tested. So there's a little bit of built-in selection bias there. And I have a theory that once the new American Heartworm Society recommendations are adopted and more cats get screened, I am predicting that we might see the percentage lower, but we'll see a lot more positive cats, numbers of positive cats.
Yeah, that definitely makes sense. So we don't know what's out there until we look for it, right? Yeah, we'll definitely see.
Exactly. And I believe you asked me another question about studies. I mean, we have a lot of studies in the literature that look at, the number of positive cats in a given area. A big chunk of my master's thesis, we looked at a lot of cats in northeastern Oklahoma, and we found positive cats. And, I've got colleagues that have also, Dr. Tom Nelson has done looking at positive cats, and he's found positive cats. And so when we look, we find, but we don't have that sweeping overall nationwide, let's put together a good map. We don't have as many data points.
So it does appear that the American Heartworm Society is working towards some comprehensive analysis of feline heartworm disease studies, and that analysis that they recently completed led to some significant revisions to their feline heartworm guidelines, which is why we're chatting today. Can you explain what has changed, maybe what has not changed, and if there's a why behind that?
Yeah, absolutely. So if you look at the latest guidelines that came out in 2024, and then you go back and you look at previous versions, if you look at the previous versions, the feline section is much shorter than the canine section. Okay? And up to now, when it came to testing, the wording was, and I'm going to paraphrase here, was feline heartworm testing. It exists. Okay? And now you'll see that we strongly advocate to screen cats as we do with dogs with antibody testing. And if you really want to increase the sensitivity of your overall testing, we do heat treated antigen testing. So it's a little bit more involved. But when you do that, the sensitivity, like if it's positive, is it truly positive? If it's negative, is it truly? It goes way up when we do that. Okay. So this is based on a lot of literature that has come out over time with looking at cats and doing different diagnostic modalities, doing antibody, doing antigen tests before heating and doing antigen tests after heating. So there was enough evidence in the literature to say, look, in these areas, when we apply this gold standard of antibody and a post-heated antigen test, the prevalence from positive cats is not significantly different than that of positive dogs. And so because of that, we're seeing, like, okay, in a given area, our working hypothesis is however much dog heartworm you see, there's that much in cats at least. And so this is the reason there's a lot of scientific justification for making this recommendation to, yes, as a practicing veterinarian, we understand the difficulties, we understand there's a conversation to be had, but we really do need to be screening cats.
Yeah, and I'm sure the canine community faced these same challenges when they initially introduced the idea of testing as part of a routine annual exam. So that's definitely interesting. So, why is the American Heartworm Society putting additional emphasis on heartworm screening in cats, knowing that there's no approved adulticide medication for this specific species?
That is a brilliant question, and one that I get asked a lot of. Well, what difference does it make? We're going to do the same thing. And here's the difference that I see. Okay. It is super important to know if cat's truly positive or not. We need to know if there's adult heartworms in the pulmonary artery to the best of our ability. And has the cat been fed upon by a mosquito and have immature adult worms wandered through, the cardiopulmonary system? And that's where we get our antibody positive. Okay? We need to know that. We need to know that to have a good conversation with the client. So if we do get to true positive, which is antibody positive, antigen positive, then the next question is, well, we can't treat it like a dog. So how I say is like this. When a dog is positive, we manage the patient. When a cat is positive, we manage the patient, and we manage them differently. In dogs, the management involves getting the worms dead as fast and as safely as possible. And the American Heartworm Society's got well-established guidelines for that, with start on a heartworm prevention, start on doxycycline. Then after a period of time, we come in with our 3 doses of melarsoline, and we make those worms as dead as soon as possible. And that's how we manage a dog. How we manage a cat is different. We don't use melarsoline in cats. And so how do we manage it? How I manage it clinically is I'm going to talk to the cat owner like I do the dog owner. I have positive tests. Now I need to know more. I need to know, what kind of damage is happening in lungs. So I'm going to order CBC, Chem, UA, radiographs, and quite possibly an echo. And just to get a overall, here's where we're at with this cat. Maybe this cat needs to be on some anti-inflammatories. Maybe it needs to be on, different things right now. But here's the most important part to me, the most important part. We have to have a conversation with the owner that your cat has adult heartworms in its cardiopulmonary system. Fact. These worms in the cat are going to live somewhere between 2 and 3 years. I don't know when they got infected. So sometime between now and say 3 years from now, if your cat has any respiratory issues at all, anything at all, any coughing, any wheezing, any dyspnea, anything, you do not wait and see how they do. You're going into the veterinarian immediately. If it's in the morning, you don't go to work. You're going to take the cat in. If it's in the evening, you're going to get the cat to urgent care. Because if these things are happening, this could be the beginning of a wicked storm. This could be the beginning of worms dying. And when worms die, their cuticles break down and they release massive amounts of antigens. Well, when that happens, the cat's immune system goes completely bananas and can lead to an anaphylactic shock situation. If the cat is in the hospital, their chance of survival with oxygen, bronchodilators, supportive care, all of these things goes way up. It is not uncommon for cat owners to see this, mild little, oh, he's kind of breathing a little funny, and then go to work, go to the store, go take the kids to the ball game, whatever. And then when they come home, the cat has passed away. It can happen that quickly. So this is why I have been, for as long as I can remember, a jump up and down, pound on the table, like we need to test cats, even though we're not going to manage them by making the adult worms dead as possible. We can manage them by having a well-informed discussion with the client so that everybody knows this. And I do it in a way that's not like scary. I don't want you like not sleeping for the next 2 to 3 years. I just need you to be aware that if this is going to happen, run, don't walk to the veterinary hospital.
And I'm sure all of the ER hospitals appreciate that diagnosis for the dyspneic cat that arrives.
Oh my gosh. I mean, the ER folks that I talk to, the urgent care folks I talk to, they are so grateful that they don't have to go through all of this stuff. They're like, my cat's heartworm positive. Now it's this, boom, now we can get after it because we know time matters. And
Yes.
so, how many times has any of us been presented with a cat in a respiratory crisis? Wouldn't it be great to know what you're dealing with so that you can get after it?
Yes. And that leads me to my next question for you. Behavior change. It is not easy to get people to change behavior. In fact, there's a whole science, implementation science, that's all around behavior change and how long that takes. We won't dive into that. But, I can recognize that perhaps behavior change is not going to be easy or implemented rapidly, and that veterinarians perhaps aren't going to start wholesale heartworm testing in cats overnight. So, knowing that it will take time during their appointments to collect perhaps that extra blood or even have those conversations, and then there could be an additional accrued cost to cat owners, how do you navigate and address these concerns regarding change? And what do you see as the starting place for change in our workplaces?
So for me, when I think about change and if I was going to change anything with my team, and my team grew to trust me over time, that if I came to them and said, guys, I'm going to ask you to do a hard thing, that the team trusted me and they knew that this juice is going to be worth the squeeze in the end. And so I think just having that trust that we're not just going to change for the sake, but there's a good reason. So I always started with why.
Mm.
I start with the why. I don't get to the how. I get to the why. Why are we doing this? And, I'll go through some high level, like this paper shows this and this paper shows this. And, go through some of the science and then go through, get into the how after that. But I get the why done first. And I do my best to get buy-in. I do my best to get the buy-in. And then in my practice, we would do role-playing exercises. When I do a new thing, I would look around the room and I would read body language. And I would find the person with the most crossed arms, furrowed brow, like, Adolf, I ain't picking up what you're putting down over here. Okay. And I would say, okay, Jill, I never had anybody named Jill, so I'm just using Jill. We're going to go into the exam room and you're going to be the most difficult, just fight me on every word client you can channel. And you're like, oh, I can picture Mrs. Jones. She's just like that. I'm going to be Mrs. Jones. And I'm like, I'm going to be you, Jill, and we're going to have a conversation. And so we would walk through that together, and man, she'd just throw everything at me. And I'd be like, I would be empathetic. Wow, I hear what you're saying, Miss Jones. I get it. I understand. Can I tell you this? And so then we would just work these things out. Before too long, Jill sitting in that seat's nodding along with me, like, okay, yeah, yeah, yeah. So I'm getting out all the reservations that my team has about making this change. I'm getting all that out. I'm addressing it in a role playing scenario that's safe. It's a safe space. Okay. So then next role play, we switch places. I'm like, okay, I'm going to be the client who doesn't want to spend any money on the cat, and you're going to explain the why behind it. And as my team would find their voice, then we got practice. So then we could go into the exam room and have great conversations with the clients. And that's just the beginning of the change. So then if we get all of the team together, like we're all singing off the same sheet of music, then now we've got to go in client by client and change that. And how we made that, we addressed every single pushback issue that we could possibly think of. When it comes to the cost, okay, we're adding additional tests. Clearly that costs more money, right? So what we did is we did packages, like here's everything the cat needs at the annual visit. So we didn't get high centered on the cost. We just said, your cat needs all these things. And at the bottom is a number. And so everything is line itemized out at zero. The heartworm test is zero. The vaccines are zero. The fecal exam is zero, but put all those together and it's this amount of money. And we got a whole bunch who said, yes, let's do the package. Mm. Then when we got to oh my gosh, that's more than it was last year. So then we wouldn't have that conversation with every single client because we've already got the yes with 4 to 5 out of 10 of them. Now we just need to have it half as many times as people thought we would. And then we would say, we do more testing than we did last year. And here's why. Very short. We do not give the War and Peace version of why we did this. Maximum of 3 to 4 bullet points. That's it. We're doing more testing. new research shows that cats have as much heartworm as dogs. So we're doing a little bit more testing in here. So then we get a few more, okay, now I understand, let's go to yes. And now we're down to just a few clients who are like, oh my gosh, that's still a lot of money for a cat. So then we work with those guys. And it's not the heavy lift that most people think it is.
Yeah, and I'll just reiterate your earlier why with you have a diagnosis. And I come from the world of emergency. I'm a VTS in anesthesia and analgesia. I've always worked in emergency referral practices, and just the number of dyspneic cats that present to the ER to be that much further ahead with an idea of what could be going on probably saves some money for those clients in the, unfortunate long run, should they have a situation where they have to go to the emergency room. That's a huge why for me to be on board advocating. So I appreciate that you shared that earlier with us as well. Now, I promise, last question. If you could look into your crystal ball, where do you hope we will be in terms of feline heartworm diagnosis and prevention in the next 5 to 10 years?
If I could write up an order and send it to the universe, and the universe sent me back a yes, we will do this, it would be this. It would be that, veterinarians, veterinary team members take a look at this and they see, okay, I see the value in this. And more cats get tested. Over time, it would be amazing if the diagnostic community could come up with more accurate, easier to obtain ways of determining true positive or true negative for a cat. Whatever that looks like, smaller amount of blood, maybe other, body fluids, maybe, something that's just easier on, because I'm all about, giving the cat the most stress-free visit it can get, right? And so when we collect that sample, we can send it in and get something, different targets, different things that would be, getting that accuracy level up, where it is with dogs, right? And then the more accurate the tests get, the more tests get done, then we're going to get a better handle on the true prevalence of feline heartworm disease. That will, in my opinion, lead to veterinarians, veterinary team members really elevating this conversation up on their list of priorities. Because again, I still work as a real doctor. I get it. I've got a short amount of time to cover a great deal of information. If I can shorten it, we can just do this thing easy, get a number, then we can build more accurate maps for cats. It'll raise awareness and more cats will be protected. The threat today is greater than it's been, but the awareness isn't where it needs to be. And so if I could look into my crystal ball, it would be more cats tested, develop more tests, better tests, accurate tests, easier to obtain samples, and then we would get up to where we need to be with getting our cats protected.
Well, and hopefully this podcast pushes a few of our colleagues over that hurdle of having those conversations and understanding the importance of, recognizing and testing for this disease. We really appreciate Dr. Adolf, you joining us today, and the American Heartworm Society as well for sponsoring this podcast.
Thank you so much. It's been a pleasure.